Welcome to this video on the care of the client with cancer. Our learning outcomes include describing the reproduction and proliferation of benign and malignant cells. We will also discuss the assessment, diagnostic procedures, and development of the nursing care plan. Additional learning outcomes involve discussing reinforcement of the teaching plan, implementing culturally appropriate care, and relating principles of quality improvement and evidence-based practice. Abnormal cells can be either cancerous, which are malignant, or non-cancerous, which are benign. We will now compare these two types. Benign cells are local, cohesive, and have well-defined borders. They exhibit slow growth and are encapsulated, making them easily removable and generally non-recurrent. Malignant growths are categorized into four main types: adenocarcinoma, sarcoma, lymphoma, and leukemia. These originate from different types of tissues and system. Cancer cells begin as normal cells, but mutate and change their DNA blueprint, allowing them to reproduce uncontrollably within the body. You can see the structural difference here. Assessing the client involves taking a comprehensive health history, including risk factors such as age, sex, ethnicity, and a psychosocial history. These factors can predispose individuals to certain types of cancer. Metastasis is the process where cancerous cells travel through the blood or lymph system to other parts of the body. Unfortunately, 50% of cancer has metastasized at the time of diagnosis. The table illustrates common primary tumors and their common sites for metastasis. For example, lung cancer often metastasizes to the spinal cord, brain, liver, and bone. Part of the physical assessment involves recognizing warning signs of cancer. These include changes in bowel or bladder habits, unexplained bleeding, or the presence of a lump or thickening. Cancer risk factors can be hereditary or environmental. Environmental factors include occupation, tobacco and alcohol use, diet, obesity, and sun exposure. Known carcinogens include viruses, drugs or hormones, chemical agents, and physical agents. Physical agents include genotoxic substances and promoters like alcohol, which accelerate cancer development. Differential nursing assessment involves recognizing abnormal signs and symptoms. These include lumps, changes in moles, unexplained weight loss, and changes in bowel or bladder habits. Other symptoms to watch for include persistent fever, fatigue, pain, non-healing lesions, white spots in the mouth, and difficulty swallowing or hoarseness. Cancer screening methods include self-exams like breast and testicular exams, as well as clinical procedures such as pelvic exams, digital rectal exams, and hemoccult testing. Early detection is key. Assessment data should cover the chief complaint, medical history, physical problems, physician's diagnosis, treatment expectations, activities of daily living, home management, and psychological health. Diagnostic testing involves various methods such as radiological and imaging studies, fiber optic procedures like colonoscopy, biopsies, serum tests for tumor markers, cytology, and a complete blood count or CBC. Blood tests are crucial for detecting cancer, measuring antigens like prostate-specific antigen, PSA, and carcinoembryonic antigen, CEA, as well as alkaline phosphatase, hormones, proteins, and enzymes. Cancer staging determines the extent of the tumor, including its classification, grading for aggressiveness, and staging for spread. The TNM system is a common method used for this purpose. This visual illustrates how tumor size, spread, and lymph node involvement contribute to the cancer stage. Cancer treatment aims to eliminate the tumor through surgery, prevent metastasis, reduce cell growth with chemotherapy, promote function, and decrease pain for the client. Nutritional support is vital, including supplements, small frequent meals, and a preventative diet. Maintaining a healthy diet can also minimize cancer risk. Surgical management can be preventative, curative, or palliative. It may be used to obtain a biopsy, remove the tumor, or provide symptom relief. Radiation therapy can be delivered internally or externally. Safety precautions are essential during treatment, and skincare is important to manage potential side effects like radiation dermatitis. Chemotherapy uses drugs to disrupt cell synthesis, metabolism, and replication, often given in combinations over several courses. These powerful drugs target malignant cells. Chemotherapy drugs are classified based on their effects on the cell cycle and their pharmacologic action to effectively target cancer cells. Key classifications of chemotherapy drugs include alkylating agents, antimetabolites, anti-tumor antibiotics, mitotic inhibitors, hormones and antagonists, and miscellaneous agents. Alkylating agents are broad-spectrum and disrupt DNA at the time of division. They can be vesicants and have side effects affecting the GI tract and hair follicles. Antimetabolites mimic nutrients to disrupt or slow cell growth. Examples include methotrexate and 5-fluorouracil, which can cause bone marrow, GI, and possible liver toxicity. Anti-tumor antibiotics, derived from bacteria, bind with DNA to injure cells. Examples include bleomycin and doxorubicin. Side effects can involve rash, cardiotoxicity, tissue necrosis, and mucositis or stomatitis. Plant alkaloids like vincristine, vinblastine, etoposide, and Taxol interfere with mitosis, acting during the M phase to prevent cell division. Side effects include bone marrow suppression, cardiotoxicity, and stomatitis. Hormone medications such as dexamethasone, diethylstilbestrol, prednisone, and megestrol are also used in cancer treatment. They can cause side effects like weight gain, insomnia, abdominal distension, flushing, and gynecomastia. Hormone agonists like tamoxifen help lower circulating hormone levels to prevent hormone-related tumors. Common side effects include hot flashes, nausea, vomiting, and headaches. Analgesics are crucial for pain management. These include non-opioids, such as Tylenol and NSAIDs, and opioids like morphine and Dilaudid. Antiemetics are used to manage chemotherapy-induced nausea and vomiting. Examples of serotonin agonists include granisetron, ondansetron, and palonosetron. Biotherapy agents involve using the body's immune system to fight cancer. These include hematopoietic growth factors, interleukins, interferons, and monoclonal antibodies. Common side effects of cancer treatments affect mucous membranes, hair, bone marrow, and organs, including the reproductive organs. These can lead to anemia, reduced immunity, and other issues. Complementary therapies can support conventional treatment. These include adjustments to diet, mind-body therapies, botanical agents, spiritual support, meditation, and aromatherapy. Additional treatments include radiation and various complementary therapies such as botanical, nutritional, diet, mind-body, energy healing, spiritual, and miscellaneous approaches. Nursing considerations involve following brachytherapy guidelines, using chemo gloves, and avoiding extravasations, which is the leakage of a drug into surrounding tissue. The image illustrates necessary personal protective equipment, which is critical for healthcare providers when handling chemotherapy and other hazardous materials. Nursing interventions focus on oxygenation, nutritional management, infection control, comfort measures, hydration, hygiene, safety precautions, emotional support, and client/family education. Oncological emergencies require immediate attention. These include tumor lysis syndrome, hypercalcemia of malignancy, DIC, neutropenia, spinal cord compression, and superior vena cava syndrome. Anemia is defined as an abnormally low number of circulating red blood cells, which transport oxygen. It is caused by decreased red blood cells or decreased hemoglobin.